Hello. As a medical researcher, I present the findings of the REDIV01 study. This study explores the real-world clinical effectiveness and safety of dolutegravir-based regimens in Venezuelan children, addressing a vital data gap in Latin American pediatrics.
While WHO guidelines strongly advocate for dolutegravir in pediatric care, those recommendations are almost entirely based on clinical trials conducted in Africa. Our study, REDIV01, is the first to evaluate how DTG performs in a real-world Latin American setting, specifically across 15 centers in Venezuela.
Our research methodology followed a rigorous, three-stage ambispective design. We first selected a cohort of 291 pediatric patients, captured comprehensive clinical baselines including viral loads and CD4 counts, and monitored their clinical progression over a 6 to 12-month follow-up period. It is critical to note that our cohort presented with highly advanced disease at baseline. Nearly 60% of these children were in moderate to advanced clinical categories, almost a fifth suffered from severe immunosuppression, and the majority were initiated on second-line therapy. Regarding regimens, the abacavir, lamivudine, and dolutegravir backbone was the most common, prescribed to roughly 64% of patients. Remarkably, despite the challenging socioeconomic conditions in Venezuela, over 60% of the pediatric cohort achieved excellent treatment adherence of over 90%. The clinical outcomes were highly encouraging. We observed a 93% rate of virological suppression at 6 to 12 months, with more than half of the patients achieving completely undetectable viral loads. Crucially, there were absolutely zero serious adverse events requiring a drug switch. When we benchmarked REDIV01 against global trials like Odyssey and CHAPAS-4, the results were striking. Despite our patients presenting with much higher baseline severity, they achieved a 93% virological suppression rate, significantly higher than the 74% reported globally. In conclusion, the REDIV01 study successfully validates dolutegravir-based regimens in Venezuela pediatrics. It proves high therapeutic efficacy, demonstrates that excellent adherence is feasible, and confirms an exceptional safety profile. Thank you. Thank you for your time and attention. I look forward to your questions and discuss how these real-world findings can shape better pediatric HIV guidelines and policy decisions in our region.